Well, hi everyone. Again, I'm Bill Sappenfield. I have the pleasure of directing the Florida Perinatal Quality Collaborative, and we're so glad that you're here for us. Our announcement of the new FPQC initiative, Homeward Bound, focusing on NICU discharge, preparedness, and transition to home. We spend so much time and effort helping our babies to survive and have a good start, but the key is to get them home safely and to the best care system and the best love and support that they can provide. And we want to be able to help you all with some of the new information that's coming out. Next slide. So for our webinar today, we're just going to give you an overview briefly of the FPQC for those who are not used to it. We're going to talk about our discharge preparedness transition to home and how that was built. What is the initiative? What are parts of the initiative? What we're going to be offering? What are the benefits of joining the collaborative? And what do you really gain by doing so? And then how do you apply to participate? Again, anytime you have questions, feel free to raise your hand, submit something in the chat. We have someone actually watching it, and we'll also be asking questions at the end. We'll also be answering some of the frequently asked questions at the end just to help people in advance. Next slide. Again, it's just important to know that FPQC's whole vision is that all Florida's moms, infants, and families have the best health outcomes possible through receiving respectful, equitable, high-quality, evidence-based perinatal care. And we live by this vision, and that's our whole focus. We are voluntary, we're data-driven, we're population-based. We want to include everybody. We go strongly by evidence and better practices. By Equity Center, we're saying that we want everybody to have the same good outcomes. And we're a value add. We want to be an value add to the family, to the hospital, the provider, to the community. Next slide. And we couldn't do this. The collaborative was formed by its partners and funders over 13 years ago, and we continue to get support to do this through all of our various partners, and we thank them very much. Next slide. And then just that you're aware, we now have a really exciting and powerful team. Dr. Vergabi Guy and Dr. Petula Panagos are going to be our two provider co-leads. Sue Bowles is coming back as our nurse consultant. We're very blessed to have Layla Vernon serve him as our family lead. Lori and Linda are going to be the FPQC leads on this initiative going forward. We have a QI team with Nicole, Stephanie, and Sarah, and a strong data team with Stephanie and Ben. We're here to help. You don't need to reach out to us individually. If you have a question, you have a need, never hesitate to email fpqc@usf.edu, and I promise you we'll get it to the right person. Next slide. So how did we get to Homeward Bound? This is just to remind people that we are a collaborative and we use a collaborative process. The first thing we do is we inform an infant health committee. As a participating hospital, you can have a volunteer or two serve on that committee to help us with the decision-making process. We also invite our partners and other key stakeholders. That group will look at the data, what other PQCs are doing, national guidelines, what our stakeholders say, and they'll come up with a list of potential initiatives. Then we go out to participating NICUs and say, okay, here's the list. Which ones would you participate in? Because it doesn't do any good to develop a high quality needed initiative if no one signs up. And then using all this information, our infant health committee decides what our initiative is. And this one was voted by more than majority. It was a super majority, felt like this was the next initiative that FPQC should take on. Next slide. It's my pleasure. We're really excited. We have two new infant health co-leads. We have Dr. Vergabi Guy, and then I get the pleasure of introducing Petula Panagos. She's here at USF with us. She's been a blessing. She's just come to the state, brings extensive QI experience in her various hospitals. Thank you, Petula, and I'll turn it over to you.
Hi, everyone. We are going to go over the project design with everyone, and we wanted to start with this consensus statement. This was published in the Journal of Perinatology recently in 2022 by Dr. Smith and his group from Beth Israel that have done extensive research on NICU discharge. And what they wrote was comprehensive discharge preparation ensures an optimized discharge and transition of the NICU baby to home. Comprehensive, consistent, and early discharge preparation can lead to more effective and efficient NICU discharge and transition to home, as well as improved caregiver and family satisfaction. Families, patients, and staff benefit when an inclusive, multidisciplinary, family-centered discharge preparation program is used to prepare for discharge and transition from the NICU. And we're so lucky that he will actually be our keynote speaker at our kickoff in October. So looking forward to even more intimate discussion regarding NICU discharge. And Homeward Bound is the name of the newest NICU Quality Initiative. The Family Advisory Committee chose the name Homeward Bound because it reflects the initiative's emphasis on discharge preparation and transition to home. Here's our aim statement. Our primary aim is by June 2025, each participating NICU will achieve a 20% increase in discharge readiness for NICU infants. And we're measuring this by, number one, parental technical readiness checklist completion, and number two, emotional readiness score by a parent survey. Our secondary aim is by June 2025, each participating NICU will achieve a 20% increase in the completion of a discharge planning tool upon discharge to home. We want to share our vision with you, and it's to integrate family into family-centered discharge process that encompasses the 4 components or pillars of family-centered care, which are dignity and respect, participation, communication, and information sharing. The process begins at admission, empowering families to collaborate with the clinical interdisciplinary team throughout their baby's transition from NICU admission to discharge home. From these 4 pillars of family-centered care, we were able to develop our primary key drivers, and they're listed there. Number 1, family engagement and preparedness. Number 2, health-related social needs. Number 3, transfer and coordination of care.
Hi, it's Sue, and I want to say welcome back to our paired folks. For those of you who haven't been with us, welcome. We're so happy to hear you and have you here. And I want to talk about the first primary driver, which is family engagement and preparedness, because everything we do for our families is really getting them ready to take the babies home. And again, we want to emphasize that part of this is family-centered care, because that's a universal component of all the drivers and all of what we do. So how do we meet that primary driver? Well, we've identified some secondary drivers. So the next one is when we're looking at family engagement and preparedness, how do we do that? Well, the first thing we'd like to do is educate the caregivers to take ownership of the infant care. They're the ones who are going to go home and provide that care. And as soon as we can get them doing it, the better it is. We want to implement a discharge planning tool starting at admission. And that's really important, especially for those of us who are nurses. That has been ingrained into us since we started nursing school. And sometimes we get so caught up in the day-to-day things, we forget about starting at admission, because the goal is always to get these babies home. And then finally, as the last part, is to engage the care team to coach caregivers on the infant care skills that they need for transition to home. So many times, I know myself as a nurse at the bedside, it's so much easier if I just do it, but that doesn't help the families. I need to coach them through what they're going to do. So that's our first primary driver and the secondary drivers we're using. So I'm going to turn it over to Ben to talk about our next one.
Thank you, Sue. Hello, everybody. My name is Benjamin Gessner. I'm a data analyst here at the FPQC. And today I wanted to take us through our primary key driver of health-related social needs. Here we have two secondary key drivers. So our first being assess family needs in connection to resources. Now CMS requires all those over the age of 18 to have a health-related social needs screen or SDOH screen done. We want to make sure that that screen is either communicated from the maternal side over to the NICU side, or if there isn't one done yet, completed when it is on the NICU side. So all those who may have positive screenings are able to get those connection to those resources. Our second key driver would be train and commit to dignity and respect in all of our family interactions. We want to have respectful care trainings and make sure that all of our providers and staff can commit to dignity and respect in all of their family interactions. And with that, on to our next primary key driver.
Hi, thank you. So my name is Gabi. I will be talking about the third primary key driver, which is transfer and coordination of care. So in the transfer and coordination of care section of this initiative, we have really focused on three secondary drivers. The first one is really orienting their caregivers to the primary medical home. So really helping families to navigate leaving the hospital and the hospital medical team to joining a new medical home outside in the outpatient world. As in addition to the medical home, another secondary driver is coordinating referrals. So we plan to help with coordinating referrals to subspecialists, to rehab services, and also mentoring programs, which can be very impactful in the lives of families. And then thirdly, we will be really working and focusing on the discharge summary. So our third secondary driver was to provide a comprehensive discharge summary to caregivers and the care team.
Oh, and we have some foci that we're looking at. This is Sue again. So what do we really want to look at? We really want to look at that engagement of the family and the caregiver, participation in care from admission through discharge. And that's the easiest way we know that we can really bring them in and really make them feel, I mean, how many of you have felt like, or have heard parents say that they didn't really feel like the baby was there? So we really want to bring them into that. And we also want our environment to be welcoming and supportive and really respectful of the individual patient and the family values. And then with that, we're going to create a family-centered hospital and unit policies, guidelines, and procedures, because we will have that open collaboration and partnership with our families. And to do that, we will have checklists and other appropriate tools to track family emotional discharge for readiness, because if the family can do all the skills, but they're not emotionally ready, are they truly ready for discharge? Next slide. So how do we get there? We're going to develop personalized transition plans considering unique medical needs, because we all know every baby isn't the same. And we need to look at the family, the social support, and the environmental factors when they're going home. We want to make sure we have an efficient referral system. And there's a way where we have clinician to clinic handoff to support those families after discharge. And we shouldn't just be like, okay, they're gone, bye. Don't never have to worry about it again. We want to make sure they have a good handoff and support them. And then we want to emphasize the need for family education about the medical care and clinical process through admission to bolster family competence and confidence as caregivers, because they're the ones who are going to take these babies home and care for them. So we want to make sure that they understand they're competent to do it, and they have the confidence to do the care they need and to do what they need to do when they need to do it. Okay, next slide for whoever.
Thank you, Sue. Good afternoon, everyone. I am Estefania Rubio. I am the data manager at FPQC, and I will be briefly sharing the data plans for the initiative. But first, as a collaborative, we use data for learning, inspiration, and direction, never for judgment. Your data security and confidentiality are critical to us, and details of the measures we take to keep your data secure are laid out in the data user agreement, which you will receive upon acceptance of the initiative's application. We are very, very intentional about the data that we collect in an effort to reduce your workload. So we will only ask for the essential data that truly matters to guide and inform the initiative. That being said, when your hospital joins our initiative, we will ask you to track specific measures and report back to us. So first are the patient level data, right? That will have to report monthly, and we will only ask for a sample of your patients. We will ask you about their demographics and whether or not the caregiver received a health-related screening and referral done, if the discharge planning was completed, and that is in reference to the technical skill assessment, the completion of the tool, if there was clinician to clinician handoff, if the discharge summary was available for the families, and if referrals to specialty appointments, therapies, and community services were done. Next slide. We also want to assess the parental emotional readiness prior to discharge. So FPQC will provide to you the QR codes and the links, and your teams will have to distribute those surveys prior to discharge. The survey is very short. There are just 3 questions that assess the emotional readiness of the parent to bring the baby home, and additional demographic questions. So once the parents complete that survey, that will come directly to us. That's why it says auto submission. So that will be continuous, right? And then next. And then finally, the last level is the hospital level data. We will ask you this in regards of dignity and respect training and commitment, and policies and guidelines to support Homeward Bound. So this is to build your hospital capacity. And we will only ask you for a quarterly update of the status of the implementation of all those things. So for those who have been part of the previous initiatives, this process will feel quite familiar. If this is your first time, rest assured, we will provide in-depth information, necessary tools, materials, and everything you need to simplify data collection and the submission process. Once you provide that data to us, we will generate monthly reports to your team. And these reports, you can use them to monitor your progress, to provide a benchmark for comparison with other hospitals participating in the initiative, to assist in strategic changes, and also to acknowledge the efforts of your teams. So data throughout is pretty exciting. We will be providing all the materials, all the tools, everything you need to do this process. Next slide. All right.
Well, hello, everybody. I'm Lori Reeves, and I'm the Associate Executive Director for the Florida Perinatal Quality Collaborative. And I just want to pause for a moment before I start these slides just to say we're giving you a lot of information rather rapidly, but we will have a section at the end of the webinar for frequently asked questions. So we'll go through some of the most commonly asked questions, and we'll have time for you to ask questions and have a little bit of discussion. So we'll make sure that we get your questions answered. So why would you want to participate in an FPQC initiative? Well, the bottom bullet kind of gives it all away, but the Florida statute requirements right now require hospitals to do 2 initiatives with FPQC at all times. So this definitely qualifies as one of those initiatives, but certainly there are many other reasons to be a part of the process. We provide a complete QI initiative. We don't charge anything. We include the change package. We include, as Dr. Rubio was just describing, the rapid data reporting, coaching, mentoring, and sharing. Every initiative that we do is based on evidence-based guidelines. We do a lot of research, and we bring in experts, like we have Dr. Smith coming to our kickoff, for example. And what we know from evidence, publications, and our own experience as well, is that QI initiatives that have multiple hospitals participating are more successful. They have earlier results, they have a larger impact, and the practice gains that we achieve are more sustainable. They also promote some really incredible networking among clinicians around the state. And we have seen this in the increasing engagement of hospital leaders volunteering to help one another at other hospitals with challenges and questions, at the number of nurse and physician and midwifery experts that agree to help us as coaches and mentors and leaders for our initiative. So it's a great networking opportunity. There are also multiple opportunities for publication, presentations, etc. And we also work on state and community system improvements. And so one of the things that's happened in the past is when we identify a challenge that hospitals are experiencing when they're trying to do a quality improvement initiative, we engage state and community partners to try to help come up with system change solutions. Next slide, please. We provide, as I mentioned, a lot of resources for you. Most of these are available online through our toolbox, but we also do monthly coaching calls, which are enormously helpful. And each coaching team has a pair of coach mentors, a physician nurse dyad, that will work with your hospital group throughout the project. We provide you with regular QI data reports, monthly and quarterly, plus technical support. We have office hours. So if you have questions about your data report, for example, you can join an office hour session with our data team and get those questions answered so that you can resolve any challenges that you're having. We have regular email bulletins. We customize and personalize consultations and grand rounds education. So we basically are all about service to you. At FPQC, we want hospitals to be successful. We want you to feel good about what you're accomplishing, and we want to do everything we can to be supportive in that process. Next slide, please. We do have a few testimonials, but we could probably just ask people in the call to throw in the chat if they had a great experience. But some of the things that have been said in the past is, as part of this collaborative, they've gotten so many resources and did not have to recreate the wheel, that being involved in initiatives has strengthened the department, patient care and teamwork, that it helps us examine the data and make changes in a unified manner so that we can improve our maternal and neonatal care. So lots of examples from our hospitals. Generally, we get great feedback that they are very pleased with the services and support they get as part of their initiative. Next slide, please. Okay, so timeline. Where we are right now, obviously, is the informational webinar, and then our next step over the next few weeks, we have time for you to submit your application to be a part of the initiative. Certainly, we can answer questions for you if you have additional questions before you submit. And then once you've submitted your application, we have a kickoff meeting. It's scheduled for October 18th. It will be in Orlando. We'll have more information on that in a minute. And one of the things that happens there is you'll complete your hospital's pre-implementation survey. Before that happens, though, there's some key things that you'll need to do. And Nicole Pellegrino is going to talk about those in a minute. By January of 2024, that's when your hospital kicks off its project. So that's when you start participating in the coaching calls. You'll have regular team and department meetings in your facility. We can provide on-site technical assistance if need be, and you'll start your data collection. By fall of next year, probably in September, but the date's not set yet, we'll have a mid-initiative meeting. So we'll touch base at that point about successes and challenges that we're having in the project so far. And then by May of 2025, which feels like it's very far away, but I'm pretty sure it will come faster than we expect, we'll be starting to work with you to wrap your project up. You'll do a post-implementation survey, submit your final data, and then we do have a lovely little rewards process so that we can recognize your accomplishments over the course of the project. Next slide. So, what will we do as part of this project? We're going to build a strong collaborative learning environment that's going to support your efforts in driving change. We'll coordinate, as I had stated, with state and national experts. We'll bring great resources to the table with the improvement process. We'll offer content oversight and process management for the initiative. So you don't have to, for the most part, figure out how to do the initiative. You are only going to be responsible for figuring out how to make it work in your own facility. We offer you evidence-based information, tools and resources about process change, including your coaches will be participating in ongoing QI training themselves. And so they will help you learn those tools and techniques to add to your repertoire of skills as well. And then next slide, please. You will be responsible for assembling a strong QI team, and Nicole will work with you to make sure that all of those people have responded and meet the criteria for you getting started on the project. You'll complete pre and post implementation surveys, which I've already mentioned. Attendance at our kickoff and the mid-initiative meetings is mandatory. Our experience in the past is that if hospitals don't attend in person, they tend to not get off to a good start and may never catch up with other hospitals. So we really prioritize making sure that everybody gets to that kickoff and that they come back again for the mid-initiative meeting. We want you to augment your hospital and department policies to reflect the recommended QI processes and procedure changes as part of the initiative. Participate in monthly webinars and coaching calls. Schedule your own educational and technical assistance as you need it with us. So let us know if you need help and we will make sure that you get it. That you implement adapted, recommended quality process and procedure changes within your hospital facility, and that you submit your assessment and initiative data. And just to let you all know that we did not request the Florida statute be put into place. That happened. We found out about it actually after it passed. But since it is there, one of the things that our agreement with the Department of Health includes is that we have to report back on some of the components of hospital participation. So we just want to make sure that you are aware that things like your participation in the monthly coaching calls and things like that is tracked and potentially reported to the state. Okay, next slide, I think, is Nicole. Yes, I'm going to hand off to Nicole Pellegrino.
Hi, everybody. Nicole Pellegrino, the Senior QI Analyst with FPQC. Great to see everybody today. So I just wanted to, as you can see here on the slide, all participating teams must attend the in-person kickoff meeting that will be on October 18th of this year at the AdventHealth Nicholson Center in Celebration. A great facility and central location for our participating hospitals. And if you plan to participate in the initiative, please have your champions and leaders save that date. So the application deadline is September 25th, 2023. You can go to this, you can take a picture of the QR code and go to the link. You can follow this, and you can also visit our Homeward Bound website, which is pretty easy to find. It's just fpqc.org/homewardbound. Bill has a question.
Oh, finish up, Nicole, and then I want to say something real quick.
Sure. So long story short, I'm not sure if there's a slide for this, but to get to the process of getting to the kickoff, there are a few steps that you'll have to take. You'll review that application and the site. You will ID some team members who can serve in each role. You'll have someone come and fill out the online application. You'll need your team members to each respond individually to our emails. You'll get a few documents, the data use agreement, the hospital commitment letter. We'll need both from your team. You'll send at least 2 people to kick off, more if you want, and by reaching out to us and getting your name on a wait list. You'll attend that kickoff meeting. You'll attend our data webinar. And then once all proper documentation is in, you will be considered a fully participating hospital listed on our website. And I do want to also say that if those documents aren't in by the time the initiative kicks off, you're still welcome to attend any initiative activities. The only thing is that you cannot be widely shared as a participating hospital until we all get that documentation in. So it's really important that you stay on top of that. Bill?
Yeah, I just wanted to let you know that the PQC is in discussion with a family foundation about a large grant to support the initiative. The idea behind it is to address health-related social needs. Ideally, we want families to be able to get to the ICU at least twice a week. And if we get funded, it'll provide a large amount of money to each hospital who chooses to participate to be reimbursed for transportation and parking services, lodging if it's needed, and other things to help the families be in your NICU at least twice a week. And FPQC would reimburse you for those family services. So if you're part of this initiative and you choose to participate, there may be an opportunity to offer more to your families. I can't really tell you more of that until we get funded, but we wanted to at least let you know that we are actively pursuing additional support. Thank you. I'll turn it over to Linda.
Good afternoon, everyone. I'm Linda Dettman, Associate Director for Programs and Operations with PQC. I'm going to go through some of the questions we anticipate that you have, but feel free as I'm doing that, if I haven't addressed something for you, to type it in the chat, or we would welcome hearing your voices today. Next slide. So does it cost to participate? I think we've already mentioned that, but I'll just reiterate, no. We don't charge your hospital anything to participate in the initiative. We do, because our funding doesn't typically allow us to pay for food and beverages, ask you to pay a small fee to participate in the in-person meetings. And we will also try to find additional in-kind support when it's possible to help support some of those things. Next slide. Oh no, actually, go back one slide. Just want you all to know that we are very grateful to have the support for this initiative from the Florida Department of Health and from the Centers for Disease Control and Prevention. Next slide. So how many champions do you need? You know your hospitals better than we do, but at a minimum, you need to have 3 leadership team members that are required to be part of your team. So you need someone to serve as the initiative lead, who is the point person and our regular contact person with FPQC. You should have a provider or a physician champion and a nurse champion. But you'll also need a data lead and a hospital administrator. So we will ask on the application that you provide names for those roles. Those roles can overlap. So the same person, for instance, the initiative lead might also be your nurse champion. But you need at least 3 people from the hospital to commit to being a champion. We also recommend that you include other groups or other individuals that are involved with NICU and with families when there's a baby in the NICU, case managers, social workers, and others. And we strongly recommend that you consider including a patient or community representatives as part of your team. Next slide. Who should be that initiative lead? It should be somebody who really has the ability to drive change, that can also have oversight of the initiative, management of the work that's being done to assure that you meet timelines and are able to make the kind of change that we hope that you can make in your hospital. And this person, again, will serve as the main contact with FPQC. So it needs to be somebody who is able to maintain those communications on a regular basis. Next slide. We already mentioned that we provide all kinds of support for you during the initiative, and we do offer one-on-one support whenever you request it. So we can send someone to your hospital. We can do these kinds of Zoom virtual meetings, phone assistance. We offer office hours where you can call in and speak with somebody. We are available to tailor whatever assistance you might need to your particular situation. Next slide. Are you required to attend the in-person meetings? Yes. And you will see in the application guide that has been sent out with the notices about applying for this initiative, that there's a list of things that your hospital is asked to commit to. And one of those is that you will send at least 2 people from your hospital to attend these in-person meetings. This allows them to then go back and give that information to the rest of the team. And again, if we have the space, and sometimes space is an issue with the meetings, but if we have space, we can allow more than 2 people from the hospital to attend. Next slide. Are you responsible for IRB review and approval? You get to decide that, or your hospital gets to decide that. Each hospital has their own ideas of what does and doesn't require IRB approval. Generally speaking, quality improvement is not considered to be research, and so it doesn't need an IRB approval in most cases. We will apply to our own IRB to get an official determination, which in past initiatives have been determined to be not human subjects research, and we can make available to anyone who might need it the protocol and the approval letter that we will receive from the University of South Florida IRB. But you will need to check with your own hospital to find out if you need IRB approval. Next slide. Stephania mentioned briefly about the initiative data. We do have a REDCap portal that you submit data through, which is HIPAA compliant and secure. We will have you sign a data use agreement that lays out how the data will be protected and how we are using it. And just to reiterate, FPQC is not a vendor. We're not providing services to your hospital, and there's no need for a business associate agreement to participate. Next slide. Can you apply to more than one initiative? Yes, although this is the only one that's open at the moment. I think almost all but one hospital in the state is now involved with our perinatal quality indicators initiative, which counts as one initiative. So if you apply to this one, then you will meet the new Florida statute that requires participation in 2 quality improvement initiatives at all times. You can always get more information about FPQC and our initiatives at fpqc.org. So I think that's the last of those slides. Oh, well, here's this one and how you can receive recruitment information. If you're on this webinar, you probably already get these things, but that's where you can get additional information. So sign up, look at our Facebook page, sign up on the mailing list, and I will turn it back over. I think it's back to Bill. And if you have any questions, feel free to put them in the chat, raise your hand, or just come off mute and talk. Thank you.
Yes, thank you, Linda. That covers many questions we normally get, but we do want to answer any questions that you might have. Please feel free to unmute yourself and ask. Please feel free to put them in the chat. We're here to answer any questions you might have. There is no question that is too small. All questions are good. So any questions? Well, our hope is that you will step up, that you'll use it as an opportunity to improve the care you provide in your NICU. If you're already working on this effort, this is a double reason why you should join, because you can take advantage of additional materials to help you in your effort, but more importantly, you can help your colleagues in moving them along as well. Again, this is a great opportunity, and we strongly encourage you to apply. Again, don't hesitate to email. Dr. Panicos.
Hi, I'm getting some good questions on my own text message cell phone, so I just want to share some that I thought we should talk about. For the docs on the call, we can absolutely use this towards your MOC credit for your American Academy of Pediatrics board certifications. And we can sort of do a side group and talk through that with the docs on the call and all the physician champions. And if there's something parallel that's nursing related, we can definitely maybe loop in Sue Bowles to help us with that.
We had a question in the chat. Are your DC planning tools one of the resources that would be provided? And would it be hospital specific? Yes, we have a variety of tools and pieces that you will want to use. You can take them as they are, their recommendations, or you can adapt them as you think appropriate for your hospital. And we encourage you to even go ahead and brand it however your hospital wants it done. But yes, we have a whole variety. We have a whole toolkit, which is the recommended program. We'll have a toolbox that has additional resources all there to help you within your hospital. Some are ready for you just to grab, and all of them are open to however you and your hospital want to implement. Good questions. Other questions? Well, we don't want to keep people long. Again, if you have questions, you can email fpqc@usf.edu. fpqc@usf.edu. We'll answer them right away. Otherwise, we do look forward to seeing your application and wish you the best of the rest of the day.